Hi, everybody. Today we are answering the question, how can I or my aging parents have health insurance and still not be able to afford medical care or to go to the doctor and to get treatments? This is a common question that caregivers ask because many parents are income limited, or maybe you are a caregiver and you need to go have a procedure done and you're thinking, oh my gosh, the copay is $50 or $100 or $500. How on earth am I going to afford that? So I'm going to answer the question about how can I have health insurance and still not be able to afford health care, but I'm also going to give you some tips on what you can do to learn how to get the care that you need and not need more expensive care, which is going to sound maybe a little counterintuitive, but it's an important point. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, you're going to find a lot of hope help for caregivers and aging adults. Please click below, like this video, follow my YouTube channel, share my YouTube videos so that other people can find hope, help, and support. So let's talk about health insurance. And we're going to start if you are a working adult, right? And you have health insurance through your company. How often do you go to the doctor? Do you have a primary care physician? Do you go for annual checkups? One way to ensure that your healthcare needs don't become unaffordable in the future is to learn how to use your health insurance and take advantage of it today. So I can't speak for all plans, but I know that many plans pay for an annual checkup. And the same thing for people over age 65. Medicare pays for an annual wellness visit. If there is any expense, it is a very low cost. Now you'd say, if I'm healthy, why on earth would I want to go to the doctor? Well, the reason that you want to go to the doctor is so that you can stay healthy. And if by chance there is something unknown lurking in your health or your health history, you can identify it before it becomes a larger problem. So I can honestly say that there are many people out there walking around who feel just fine, who have undiagnosed conditions like high blood pressure, high cholesterol, diabetes, maybe breathing concerns, other concerns that you really don't notice because they're not greatly impacting how you feel every day, right? These conditions are kind of what I call the silent killers, right? They go on and on and on for years, and then all of a sudden you have a heart attack. Or you get sick and you find out that you have type 1 diabetes or type 2 diabetes. Or you find out that you have a clogged artery in your heart. By then, right, those conditions have been going on for so long that if you need medical care or treatment, it is going to be more expensive. And then you may be worried about, oh my gosh, I have $1,000 deductible, or I have $1,000 copay that I have to pay, and I have absolutely no idea how I'm going to make this payment. If you go to the doctor today at your regular appointment every year, and you monitor these things and you catch them and you learn about them, you can actually be proactive to either stall a condition, reverse a condition, eliminate a condition, or manage a condition, right? But to do that, you have to be proactive and you have to listen to the doctor and take the doctor's advice. So let's say that you have high cholesterol, right? And you got high blood pressure. So part of it may be, maybe you need to lose weight. Maybe you need to eat better. Maybe you need to exercise. All of those things do take a personal commitment to your wellness and your well-being. But again, if you look at, can I do some things today to reduce my medical expenses 10 or 20 or 30 years in the future? Now, I know most people don't even think about that, right? You don't think about it until you're 65 or 75 or 80, or you have parents who are older and you're taking them to the doctor and you're taking them for treatments and you're watching all these bills for like prescriptions and they have co-pays and they got to have treatments and you're thinking, man, this healthcare is expensive, it's unaffordable, it's ridiculous, right? Because what most people realize or don't realize is that Medicare does not pay for everything, right? Your parents can have a Medicare plan and they can still have a lot of health expenses if they have a lot of health conditions. So actually learning how to use your health insurance is a very wise step to take, even if you're healthy. Because how nice would it be to go to the doctor and find out that there's nothing wrong with you? And you go back next year and you find out, wow, there's nothing wrong with me. It's kind of like, maintaining your car, or let's use the dentist, right? Nobody, who likes to go to the dentist? Nobody. I don't even like to go to the dentist, right? But I go and I get my checkup and I get my teeth cleaned and it's like, whew, man, there's nothing wrong with my teeth. But then I go 6 months later, maybe I have a cavity. Well, the good thing is I caught the cavity before it got worse, right? Before it turned into a more expensive procedure that I needed. And so the thought here is really, just because you have health insurance doesn't mean that your healthcare procedures or the treatments that you need are not going to be expensive. But if you take the reverse idea of, I want to prevent unnecessary expenses for me, for my parents, for my spouse, and you go and you have your annual checkups and you get your preventative care. You get your teeth cleaned, you get your mammogram, you get your colonoscopy, you get your well women checks, right? You do those things, you are better off. And you actually become established in the healthcare system. You actually have a doctor to call if something happens so that you're not having to rush to the emergency room or one of those clinics on the corner who don't know you and they don't have any of your medical history. So it's almost like an exercise in desiring to be healthy and what are the steps that I need to do to be healthy. And a lot of caregivers will say, well, Pamela, I don't have time. And it's like, I get that. But do you have time to be sick if something happens? Do you have $10,000 in your bank account that you can pay for medical procedures if you're diagnosed with cancer? So it's kind of like being proactive to prevent things that you cannot possibly predict that could happen or may not happen in the future. But with age, a lot of this is likely to happen. And the thing that nobody wants to hear is it's unpreventable, right? If we're lucky to reach the age of 60 or 70 or 80 or 90, unless we have been super proactive in our younger years, 20s, 30s, 40s, 50s, right? We're probably going to have a health condition because that's just what happens. Our bodies wear out, things happen. And a way to look at this is, and this is may not be a great comparison, right? How many of you have pets, right? How many of you have a dog? Dogs have short lifespans. Depending on your dog, it may be 5 years or 10 years. Maybe you can get 15 years out of a dog, right? They're young, they're healthy, everything's good. They get old, they start to have health problems. And so if you look at your pet and how their health has progressed, and just the fact that, when they're 10 or 12 years old, they're going to have health problems. Dogs, like people, get diabetes and they get cancer and they get all kinds of health conditions and arthritis and hip problems and things like that. So a practical way to look at a lifespan is that lifespans have limitations and good health has limitations. And so the more that we can do at a younger age to be healthy and to be proactive and spend a little bit on a copay to go to a doctor or spend a little bit on a medication or spend a little bit here and there, it can prevent a lot of healthcare expenses later because we have more health conditions. So really the way to answer, how can I have health insurance and still not be able to afford medical care, is to actually use your health insurance. Use your health insurance for all of those preventative things that you know that you should do and that the doctors tell you that you should do, but you think that, oh, I don't have time to do it. I'm too busy. I'm healthy. I don't need to. Or if you're caring for your parents, it's like, yeah, my parents should do that. Maybe they shouldn't. No money, no time. If money is a problem, community health centers in your area are great resources. The copays at community health centers are usually lower. They have social workers. They have a lot of other assistance. They have health education programs, a lot of support. So if you truly are struggling to pay for health expenses on your regular insurance, check out a community health center. Check out your local Medicaid program. There are options to be able to pay for preventative care that we all need and that we all can benefit from. So I encourage you, please do learn about health. Learn about the health insurance that you have. Learn how to use it. Be healthy, because the healthier that you are today and the more that you take care of yourself today, the healthier you will be tomorrow. Thanks for being here. I look forward to seeing you all in another video. Again, please click below to like this video, share my YouTube channel with other people who are looking for hope, help, and support on practical topics on caregiving, aging, and everything in between.